Hi, this is Dr. Rachel Brown, Medical Director of Prevention and Wellness with Business Health Solutions at Prisma Health, and this is our COVID and Wellness update. Now, the last time I talked to you was 2 weeks ago, and a lot has happened in that time. Today is September 10th, so understand the information you hear today is only accurate until September 10th. But I don't have great news for you. This surge is continuing, the numbers are getting worse, and we are finding more and more people getting sick with COVID and more folks having severe consequences from COVID, mostly from the Delta variant. What I'd like to do is share with you some numbers, but let me share my screen so you can see the resources. But I would like to also share with you that South Carolina now has the distinction of having the highest number of cases and highest rate of rise of cases. We're jockeying with Tennessee for that #1 spot, but this is not a esteemed distinction by any stretch of the imagination. You can see here that every single county in South Carolina falls into the high transmission risk category. Some of the counties each week have come down a little bit. Most of them are still going up, but the entire county is still in that high transmission rate category. You can also see that the surge continues. We anticipate with the start of school and with mass gatherings such as football games and otherwise, that we will continue to see this for several weeks. More and more folks getting COVID, more and more folks getting sick and being admitted to the hospital. Of course, we watch our vaccination rate very closely because we know this is the #1 way to mitigate this pandemic and to stop this from occurring. We see a little bit of a bump here. Today, we see that we've got 48.9% of South Carolinians fully vaccinated. 2 weeks ago, that number was 46.4, so we're up about 2.5 percentage points there. The folks who have started to get vaccinated or are partially vaccinated has gone from 54.7% up to 57.9, so a little over a 3% increase there. However, we are nowhere near close to the vaccination rate we need to get this pandemic under control in our state. What I feel is important to share with you most is what's happening with folks who are getting COVID. So at Prisma Health, we share our hospitalization data each day. Today's data is not out there, so I'm sharing with you yesterday's, September 9th data. And you can see that we have 554 patients in the hospital who have COVID. Of those folks who've been hospitalized, who were sick enough to be hospitalized, this doesn't include the others who maybe were seen in ambulatory care settings or the emergency department or urgent cares who have COVID but are at home recovering. Of these 554, we've got 42 who were vaccinated. The rest were unvaccinated. The vast majority of sick patients with COVID are unvaccinated. This is about a 7.5% breakthrough rate of infections within hospitalized vaccinated folks. When you look at who's getting really sick, the folks who need intensive care are in the ICUs. There are 132 people in our ICUs right now who have COVID. That is a huge number. And of that 132 people, only 8 were vaccinated. So this is about a 6% breakthrough rate. Everyone else, 94% of the folks who are in the intensive care units are unvaccinated. And then finally, the sickest of our sick who are admitted, the folks who cannot even support their own breathing and who are on ventilators, have breathing machines and tubes down their throat. There are 4 who are vaccinated out of 84 ventilated patients. That's about a 5% breakthrough rate. Now, these numbers are similar for our entire healthcare system across South Carolina. The other hospital systems are seeing these same sorts of numbers. And it puts a fine point on what we've been trying to say for months, and that is vaccinations protect from severe disease and death. It's clearly mostly unvaccinated folks who end up getting sick and admitted and on breathing machines. So I'm going to stop sharing my screen for just a moment with you and talk about what you can do as an employer. And we're going to talk about President Biden's announcement from yesterday and what that's going to mean for you as an employer. So first and foremost, as much as I hate to say it, we're going back to masking. We have recommended this for months now as we saw this surge on the horizon. Regardless of vaccination status, everyone should be masking when they are around others in public spaces and in workspaces. Regardless of whether they're vaccinated or not, your employees should have a mask on when they're around each other. The obvious way that you all can help stop this pandemic and keep your workforce safe and healthy is to get folks vaccinated, right? And pretty soon it may be more of a requirement than an encouragement. So let's talk about President Biden's announcement yesterday, because this is going to affect, they're anticipating, about 2/3 of our nation's workforce, which means probably it's going to affect your workforce. So he is requiring that organizations, businesses, companies that have more than 100 employees require their employees to be vaccinated or require them to have weekly testing. He also is requiring that employers provide PTO for the time that employees go to get their vaccine, and also if they have to be out due to symptoms after the vaccine. Now, let me pause right here and make it very clear that symptoms following the vaccine are not severe adverse reactions, okay? They are not COVID. Most folks are going to feel a little crummy after the vaccine. That is their immune system doing what it's supposed to be doing. That causes us to have fever. That causes us to feel fatigue and muscle aches and headaches. That's not unexpected, and it's also very, very temporary. Okay, it's about a day, day and a half. Now, OSHA has also issued a statement that says they do have the power to issue these requirements and these standards. And in the coming weeks, 75 days is being thrown around as a timeline, they will have an official requirement and mandate statement. In addition, representatives of the Health Information Privacy Portability Act, HIPAA, EEOC, and DOJ representatives have all come out to say that the legality of this is legitimate, that there are no human resources issues, that the vaccinations can be required, and that asking about vaccination status is also not against the rules. The punishment for an organization not following these requirements will be fines, significant fines. So, encouraging your employees to get vaccinated has always been the best way to mitigate this pandemic. It looks like it's also probably going to be a requirement for you. Or we're going to have to do weekly testing, and we can talk about that in just a second. So one of the things that organizations have asked for our support on is really communicating to employees the best and most truthful information about the vaccine so that we dispel these myths and put people's minds at ease about getting the vaccine. So I can do that for you. And we talk about the Delta variant, that yes, you should still get your vaccine if you've had COVID before, that breakthrough infections do happen, but they're very rare. And so the rationale, well, if you can still get it, I might as well not get the shot, does not hold water. Also, that healthy and young people are getting COVID at alarming rates now, as opposed to the elderly, and also around vaccine safety and how now we even have full FDA approval for that Pfizer vaccine. So please invite us, but also reach out to your peer influencers. What we're finding is that folks really listen to their colleagues that they respect, who have either been vaccinated or have had a bad experience with a family member with COVID and encourage vaccination. Those are the folks who are going to influence your workforce. The other thing you can do is continue distancing. If as much space as you can put in between adults when they're together, 6 feet is optimal, the better. Children can be separated by 3 feet. It's felt that that's safe. If you can clean and filter your air optimally, that is also going to help your workforce. And also, if you are strongly encouraging folks who are sick not to come to work, outbreaks are part of the problem, right? And they will devastate your workforce. So encouraging folks to stay home and setting up policies that don't provide barriers to folks who may need to work from staying home when they're ill. Testing is also another strategy. And now that President Biden has offered the either or solution of vaccinating your employees or testing them weekly, it's going to be even more top of mind for everyone. So let me talk a little bit about that. But understand that we don't have full recommendations yet from OSHA or others around what this should look like. But let me just first say that anyone in your organization who has symptoms needs to be tested, whether they've been vaccinated or not. If they have symptoms and they're concerned, they need to be tested. They need to stay home and quarantine and try to keep themselves separated from others until they get the result of that test, right? We have to assume they have COVID until the result of that test comes back negative. Anyone who is unvaccinated, who's had close contact, so within 6 feet for greater than 15 minutes without a mask, we may even see with a mask, any kind of close contact should also quarantine at minimum for 7 days with a negative test on day 5. That's for your unvaccinated population. So they have to go home for a week if they've been exposed. However, your vaccinated population, if they are exposed, they do not have to quarantine, which is another benefit to having more of your workforce vaccinated, because you're not having to send groups of people home who may not end up even being sick for a week at a time. So unvaccinated folks do not have to quarantine. We do recommend that they are vigilant about wearing their mask and that they watch for symptoms, and the moment they develop a symptom, that they get tested. There is an option, you don't have to do this, but there is an option to test vaccinated exposures somewhere around day 3 or 5 to confirm that they're negative. That is not part of the recommendation, though you don't have to feel like you need to do that. Let's talk about what that testing looks like. Far and away, PCR testing is going to be the best way to evaluate your workforce. So there are two general kinds of testing. One is antigen testing and the other one is PCR testing. Antigen testing is only accurate to a reasonable extent when there's a positive result in someone who has symptoms. We can trust that. Anything else we have to have confirmed. So if you're doing an antigen test and someone has symptoms and their test is negative, you're going to have to get another test. You're going to have to get a PCR test to be sure that really is negative. However, with PCR testing, you can test symptomatic folks, you can test exposures, and you can feel fairly confident that a positive test means a positive test and a negative test means a negative test. So we at Prisma Health use PCR testing. We only use antigen testing in one very, very small area where we are simply looking at folks who are symptomatic. For the most part, we use PCR testing, and that is what we recommend to our clients. There are FDA approved devices that will do on-site rapid PCR testing, so point of care PCR testing that you can look into. DHEC also has drive-throughs that folks can use for testing right now. Prisma Health has drive-throughs that folks can use for testing. And of course, our retail pharmacy and our private labs will also do testing. Many of those retail pharmacists and labs will either allow you to broker a test through their site, offer courier services, or even on-site testing as well. We are doing on-site testing in a couple of places, and I can tell you that it is a very complicated logistical situation. It is also cost heavy, and so it clearly is a better strategy for mitigating the pandemic, keeping your population healthy, and managing your cost, having them vaccinated over weekly testing. Okay, the last thing I want to say is just to add a caveat about quarantining, because I get this question all the time. Many of you have employees who are parents, and children are being sent home in record numbers because they have either gotten COVID or they've been exposed to COVID. If you have an employee who has someone at home, a child or even another household contact who has COVID, who has a positive COVID test or confirmed COVID, that employee of yours is considered a close contact, obviously, because they live in the same household. And the quarantine rules for your employee will depend on whether they are able to separate themselves from the positive household contact. In the case of school children who come home and are sick, that's rarely an opportunity where a parent can leave a child on their own. And so that employee, parents, quarantine time does not start until the end of the child's isolation period, which is 10 days. So that parent will be home with the child for 10 days because they're exposed and they have to be under quarantine, but their 7 days doesn't start until the end of that 10 days. And they would still need a negative test at 5 days into their 7 days. So we're talking about a total of 17 days with a negative test at day 15. This is causing huge amounts of problems for our employers as they try to navigate massive numbers of people who are going home because kids are coming home sick. They get complicated. The cases get very complicated. So please reach out to us if you have any questions about who should quarantine and for how long and when they should get tested. Again, let me reiterate that any one of your employees who's a parent or a caregiver or otherwise around a household contact who's positive, who's vaccinated, that employee does not have to quarantine because they're vaccinated. Lots of perks there. Last comment I have is around boosters. Boosters are available to immunosuppressed folks only at this time. That does not mean that physicians and other providers can't prescribe the booster shot for those of us in the general population. However, it probably won't be free. We are hoping in the next few weeks to hear the official recommendations on boosters for non-immunocompromised folks, and how we can help you get boosters, shots in arms for your employers. So as always, there's a lot changing. There's a lot going on, a lot of questions around these new requirements that President Biden suggested, which will essentially mean more and more of your employees need to be vaccinated, or that you may have to engage in some sort of testing protocol. We're here to help you tease that out. I do ask that the same request that I had when vaccines came out in December, that we all be patient while we wait for those recommendations, so that we know the best way forward for you and the most cost-effective way forward for you. As always, we're here to care for you so you can care for your employees, so reach out to us for any questions.